Which of the following is the best method to dispose of needles and other sharp medical instruments, or sharps? And as a rule, when it comes to safety, anytime you see sharps, immediately think sharps container. You don't want to put it anywhere else. You don't want to put in a regular garbage, a regular container, because these are sharp. They could easily be poked into someone if not disposed of properly, and these contain patients' bodily fluids, which could have communicable diseases, and we do not want to spread that to anybody else. So therefore, anytime you say sharps, no exceptions, always use the retractable needle if that's an option to close the needle, not recap the needle, but press a button that retracts the needle in a spring back into the needle container itself, and then safely put in the sharps container. And we see option D is the one that says in a sharps and a puncture resistant sharps container specifically designed for this purpose. That's option D. Taking a look at the other choices here, we see option A says to dispose of them in a regular trash can. No, we do not want to do that. Option B says recap. Now, we never want to recap needles before throwing them in a container. This might be something that you may have confused with retracting the needle or using like a safety latch to push it back. So sometimes, let's say that this is your needle. Sometimes there might be like a button here. And then let's just say that this is your needle at the end. You click that button and then this will force right back into it here. The needle will come down that arrow and then go into the needle holder. So that might be what you were thinking of if you picked that choice, but you don't want to put the cap back onto the needle, especially if it was used already. And then option C says bend or break the needles, and that would be dangerous. You don't want to do that. So option D is the safe choice, and always pick the sharps container for any sort of sharp related instruments that need to be disposed.